queries queries 58 उनका दो क्वेश्चन था कि डायस्टोलिक प्रेशर क्या है एंड व्हाट इज द इंपॉर्टेंस ऑफ ए डायस्टोलिक प्रेशर, दैट इज वेरी इंपॉर्टेंट बिकॉज सबको पता है कि सिस्टोलिक एक होता है हायर वन एंड डायस्टोलिक होता है नीचे वाला। सिस्टोलिक प्रेशर सब जानते हैं कि जैसे हार्ट पंप करता है तो जो प्रेशर आर्टेरियल वॉल में पड़ता है वो देयर इज सिस्टोलिक प्रेशर, एंड जब पंप आफ्टर पंपिंग ब्लड हार्ट एक रेस्टिंग पोजिशन में आता है सो दैट इट विल फिल अप अगेन, एंड ड्यूरिंग दैट पीरियड जो आपके आर्टेरियल वॉल में जो प्रेशर मेंटेन होता है वो है आपका डायस्टोलिक प्रेशर, ये नीचे वाला प्रेशर है। तो डायस्टोलिक प्रेशर जो होता है वो हम अपना आर्टेरियल की जो आर्टरीज होते हैं जिस पर ये खून रहता है उसका प्रेशर को जो मेजर करेंगे वो हमारा डायस्टोलिक प्रेशर है। उसका इंपॉर्टेंस क्या है, हम डायस्टोलिक प्रेशर को क्यों इंपॉर्टेंट मानते हैं। सिस्टोलिक प्रेशर आपका चलो 170 180 तक जा सकता है, विथ एज सिस्टोलिक प्रेशर बढ़ता रहता है बिकॉज वी हैव लॉट ऑफ हमारा आर्टेरियल कंडीशंस में भी लिटिल चेंजेस आता रहता है, रेजिस्टेंस बढ़ता जाता है, सो वी गेट ए हायर ग्रेजुअली बढ़ जाता है। बट डायस्टोलिक प्रेशर जो रेस्ट में उतना प्रेशर बनता है उसका मतलब है कि आपका जो आर्टेरियल वॉल जो है उसमें कहीं ना कहीं प्रॉब्लम हो रही है, जिसके ऊपर मैंने एक ब्लॉग भी लिखा था, आप लोगों को बताया था। आई थिंक यू मस्ट हैव बीन गेटिंग द आंसर आउट ऑफ दैट। सो डायस्टोलिक प्रेशर अगर 90 से ऊपर होता है दैट मीन्स कहीं ना कहीं आपके आर्टरी में प्रॉब्लम, वॉल में प्रॉब्लम है। यू हैव टू टेक केयर ऑफ इट बिकॉज ये आगे बढ़ के आपको तकलीफ देने वाला है। ऑल द प्रॉब्लम्स ऑफ कॉम्प्लिकेशंस ऑफ हाइपरटेंशन कम्स विद द डायस्टोलिक प्रेशर रेज्ड because that means your artery is already in a condition where it is not, it's a resting condition also, the pressure is very high, resting condition, that means जब प्रेस करता है तब उसका और भी बढ़ जाता है। so diastolic pressure is important। now the difference of pulse pressure का आता है, there is a दो चीज़ें हैं। पल्स प्रेशर मीन्स दोनों का सिस्टोलिक एंड डायस्टोलिक के बीच में, तो जस्ट इमेजिन करिए कि पंप हुआ, ब्लड गया, एंड जैसे ही आप हार्ट रेस्ट करता है आपका लो प्रेशर जो डिफरेंस आ गया, दोनों में एक डिफरेंस आता है। सपोज 120/80 तो डिफरेंस 40, तो स्टैंडर्ड डिफरेंस होना चाहिए 40 to 60 मिलीमीटर मर्क्यूरी। 40 to 60 मिलीमीटर मर्क्यूरी के अंदर में है तो दैट मीन्स इट इज़ स्टैंडर्ड। बट अब इससे लो भी हो सकता है, इससे हाई भी हो सकता है। दैट इज वो सबसे बड़ा क्वेश्चन मार्क है। अगर मेरा डायस्टोलिक प्रेशर लो है तो क्या है, उसका सिग्निफिकेंस क्या है, बिकॉज ये तो बहुत सारी चीज़ें में होता है, बट आई विल टेल यू कि जो मिनिमम जो कुछ चीज़ें होता है जो कि आपको सबको मालूम होना चाहिए। अगर हमारा डायस्टोलिक प्रेशर लो होता है, दैट मीन्स बिलो 40, दैट मीन्स क्या होता है, उसमें 2-3 कंडीशन होता है। जैसे कि किसी का ब्लड लॉस हो गया, ट्रॉमा, इंजरी हुआ, ब्लड लॉस हो गया, फाइन, देन हार्ट इज नाउ पंपिंग इट फास्टर टू सर्कुलेट, तो उस समय में वो डिफरेंस जो है ना वो कम हो जाएगा दोनों में, लेस देन 40 हो जाएगा, बिकॉज उस हार्ट बहुत जल्दी जल्दी पंप कर रहा है। दैट इज एक वीक हार्ट जो पंप नहीं कर सक रहा है, कार्डियक कंडीशन, हार्ट डिजीज में पंप नहीं कर सक रहा है, उसमें भी आपका डिफरेंस बहुत कम हो जाएगा। एंड एओर्टिक स्टेनोसिस मतलब हमारा ब्लड जहाँ से निकलता है, जैसे पंप किया एओर्टा होके बाहर सर्कुलेशन जाएगा, वहाँ वाल्व होते हैं, उस वाल्व में अगर प्रॉब्लम होता है देन ऑल्सो आपका, बिकॉज वो ब्लड जा नहीं सकता उतनी आराम से, तो देयर विल बी द आर्टेरियल प्रेशर विल बी नॉट मच। एंड आपको पेरिकार्डियल इफ्यूजन मतलब हार्ट के कंडीशन, बीमारी की वजह से हार्ट के चारों तरफ पानी या इंजरी की वजह से ब्लड जमा हो जाता है, हार्ट एक्सपेंशन करने का जगह नहीं है, ये सब कंडीशन में लो आपका जो डिफरेंस लो हो जाएगा। तो ये सब कंडीशन हम लोग देखते हैं इन ए मेडिकल इमरजेंसीज। नॉर्मली वी डोंट सी, दे आर ऑल मेडिकल इमरजेंसी में वी सी दीज पेशेंट्स एंड वी मैनेज अकॉर्डिंगली बिकॉज यू हैव टू टैकल, बिकॉज देयर ऑल द थिंग्स आई टोल्ड कि ये सब इमरजेंसी में कंडीशन में होता है, ये सडनली नहीं होता है, सडनली ही होता है, कोई धीरे धीरे नहीं होता है। बट द अदर वन जो कि पल्स प्रेशर इज मोर देन 60, दैट इज हाउ इट्स ए क्रोनिक कंडीशन, लाइक हार्डनिंग ऑफ द वेसल्स, आपके हार्ट के वेसल्स जो नॉर्मली जो शरीर के वेसल्स मोटा हो गए हैं तो आपका प्रेशर बढ़ जाएगा। हाइपरथायरॉयडिज्म मतलब थायराइड की दो बीमारी होते हैं, एक हाइपर कम होता है हाइपोथायरॉयडिज्म जो नॉर्मली सबको होता है, एक हाइपरथायरॉयडिज्म होता है जिसमें कि आपका ब्लड हार्ट बीट बहुत ज़्यादा हार्ट रेट बढ़ा रहता है, समझिए। एंड उसमें इन दैट कंडीशन ऑल्सो your pulse pressure will be very high. And second thing is aortic valve replacements, जब operation हुआ है, then they replace किया गया है. In those cases also it is there. And सबसे important चीज़ जो हम लोगों को देखना पड़ता है सबको, वो है stress and high caffeine intake. Fine. Stress is a, like normally if you see, we don't have heart disease. Most of the people don't have heart disease, but some people have got sometime there's a high pulse pressure. That is because of the way we are living. So all these things, high pulse pressure हमारे control में आ सकता है. And this is why this challenge is for. How can we manage this, all these things, hardening of the blood vessels and all these things, ये हमारे control में आ सकता है if we do something. I think I could answer your question. Then Mr. Suresh Chandra Patnaik sir ji, and आपके question काफी interesting था. I understand that hypertension is not reversible. It can be managed through lifestyle changes. My doubt if we improve the softness of our arteries and when, so that the root cause of, yes, it is a genuine question. Like we have hardened the artery. Artery are not hardened by itself. Because of our lifestyle, because of the way we live, because of the things we eat, because of the stress we have, जो हमारे साथ हो रहा है, उसी की वजह से हमने उसको बनाया है. So, अगर हम उस पे काम करेंगे, if we change our lifestyle, if we learn how to live a better life, because it is difficult, but if we want, if we think कि हमको सोच लिया कि हमको करना है, तो आप ये with a during course of time, this can reverse. And ये मैं scientifically it has been proved. I think it is, I'm forgetting the doctor's name. He did an experiment in 90s in acute heart block patients, 80%, 90% artery block, fine. And उन्होंने क्या किया कि 2-3 ग्रुप बनाए. एक ग्रुप में उन्होंने 30s का ग्रुप था. एक ग्रुप में उन्होंने एक्सपेरिमेंट बेसिस पे रखा. दूसरे ग्रुप को they advised only. You do this, they like we are advising. But in one group they are doing everything. They handhold करके they put them into yoga and exercise and meditation. These 3 things they have, and nourishment, food. Fine. These 4 things they included in this 4 group, and for 3 months continuously they have been under their direction. It went on, and the second group is all were 80 to 90% above blocks. And they advised them as we are advising people. And the third group, they didn't do anything. And to their surprise, the group which they have handhold the people, their 90% blocks are also reversed. I have photographs of those things when I saw them in the things. It has given. And that was the first time. It was that time stenting was just coming. That time stenting was getting introduced into the market. So stent is a necessary thing because it saves life. But the people, many of the people, when they do angiogram, preventive angiogram, they find there are blocks. But by how they are living then? They are living because उनके collateral develop हो जाते हैं. So they are living with that. But these people, if they improve their lifestyle, if they change everything, the way it should be, then these blocks, these deposits, hardening means what? Deposits of cholesterol over the arterial wall. Then only the what getting thickened, no? So that will go away. So it is possible, but not in one day. They did a thing for 3 months and they found that a lot of difference in that. So if 3 months it is possible, a person जो lifestyle change करके आगे बढ़ता है तो उसके लिए तो सब कुछ अच्छा हो सकता है. So here comes the chance, reversible, what we talk about reversal of diseases, that comes into play. It is a fact. You can reverse things, but we have to learn about it. We have to do every day. It's not that one day we'll do and next day I will not do. No. You have to be sincere enough to yourself, then it's possible. There are thousands and thousands of people ऐसे भी हैं दुनिया भर में जो कि अपने बहुत सारी बीमारियों को, even cancer also getting reversed. That is the thing, but it is few. Numbers are very few. Fine. And उनका score था 21/30, as I told you. And I think I had given you that. एक minute. The people who got, how many of you got 26 to 30 number in that assessment? How many of you? It's 26. Sir, आपन कितने आंटे ले? 24. आपन पटनेक sir? 21. How yours is 21. ଆପଣଙ୍କର ମ୍ୟାଡ଼ାମ୍ ଆପଣ 22. So ଆପଣ ଏଠି ଦେଖନ୍ତୁ, ଏଠି ଅଛି, ଆମେ ଏଇଟା ଦେଖିବା 26 to 30 self healthcare experts I consider, because they have now learned the things, they are doing the things as per the things, they can improve themselves more. And 20 to 25 health conscious individuals, that's why you are here sitting and trying to learn more and more. And 10 से 19 जो है improvement चाहिए, you have to work more, and for you people we have also a lot of things with us. And 0 to 9 they are in a high health risk, so this thing has to be taken care of. Fine. And there is a question from Dr. Prakash Chandra Ta. Can BP reduce without medication? Can BP reduce without medication? Bhola question. This is a very important question, because everybody wants that I don't want to take BP medicine. So उसमें क्या होगा? Medicine, तो question तो अच्छा है, and answer is also yes, it can be reduced. When suppose you have been diagnosed blood pressure, अभी diagnosed हुआ है आपको, and you start taking care of it. तो the blood pressure की जो numbers है वो gradually decrease करेगा. But initial phase में medication is essential, because without medication you cannot live. So most of the people क्या करते हैं कि because of misinformation they go on trying different things in the hope that I don't want to take medications. But it is dangerous. You have to take medication, and with that you try to improve your condition, and with time up medicine your doctor will go on reducing your medications, and they will come when you will stop your medicine. It's possible. Like in my case, because I had a problem in the heart problem, I told you that ectopic sarada, I had to take medicine for 6 months or 7 months. And gradually, when I started doing something, I started improvement होने लगा. तो gradually मेरे दवाई, with the advice of a cardiologist, I stopped, and I maintained it till date. I am maintaining the same thing, same routine which I did. So it is every day you have to do it. Not that 1 month, 2 months, 5 months I did, and after that, because again you will go back to that. So yes, medicine can be stopped. You can be without medicine, and it depends how much care you are taking and how much things you have learned. And here again the thing of you have to learn about your heart and everything it does, how the function. So heart ऊपर जानिया पड़ो आपन को पूरा मेकानिज्म फिजियोलॉजी एक्सरसाइज करियो तो केमती एक्सरसाइज करियो हार्ट केमती कोन हबो केमती कोन होची सब जानिया पड़ो. फाइन. Then Mrs. Rucha Kakkad has asked, is there going to be talk on this subject? Yes, we are already doing this talk, and this next every week we will have one talk. You can come and join us here. And Mr. Vishnu Mohanty, he told, I have diabetic mellitus and hypertension. Why these both? Yes, diabetes mellitus, diabetes rogopai because of the high sugar content, because of the lipid content very high. Diabetes is called metabolism ta bigdi jaye. इसलिए मेटाबॉलिज्म बॉडी में बिगड़ी गला तो तारो असर गुड़ा को उसके जो असर होता है वो अपना आर्टेरियल वॉल में आता है, तो आपको हाइपरटेंशन भी साथ में जुड़ जाता है इन ड्यू कोर्स ऑफ टाइम. सो ए पर्सन अगर अपना डायबिटीज़ को कंट्रोल रखता है, देन ही कैन ऑलवेज, दैट मीन्स वो अपने आर्टरी पे भी काम कर रहा है. सो इट इज़ अ हॉलिस्टिक वे ऑफ मैनेजिंग. इट्स नॉट दैट कि डायबिटीज़ कंट्रोल करने से हाइपरटेंशन कुछ नहीं होगा, नहीं, इट विल ऑल्सो इम्प्रूव. दैट इज़ वन थिंग. And Mrs. Harpal Rupra, she has asked how to control high BP. Yes, high BP can be controlled initially by medications only. There is no other way that you will be escaping medication, because if you don't take in high blood pressure, it will be affecting your brain, your heart, your kidney, your eyes. हर जगह पे ये affect करेगा. So please don't do anything other than taking medications. With that, start learning and following the principles which will be teaching you in next 3 weeks also. And Sodamin ma'am has told how to get rid of blood pressure. I have already answered. You can only get rid of blood pressure by आप अपने पे काम करके ही blood pressure को मुक्ति मिल सकता है आपको. And Dr. Sudhir Ranjan Samal, he's a physician, he's a good practitioner. So इन्होंने अपना, he has only asked me, I want to stop my BP medicines. He's himself a doctor. He's a very good practitioner, Dr. Sudhir Samal. And he is also having blood pressure because he was the secretary when I was the president of IMA. Because of the stress. Doctors nowadays are the most stressful people than any other profession. Because of the things are changing very fast. So somewhere you have to take care of yourself, Dr. Samal, and reduce your stress level because the timing of the food, because of multiple clinics and work pressure, it all leads to this. Stress is a thing which has to be taken care of. Stress is the biggest killer as per today. The doctors, we have to take care of ourselves first. So there comes the role of Swayam Seva. We have to do our seva. Mrs. Anita Lat, again, she also told the same thing. I want to stop blood pressure medications. But she should have been here today. This is, if Anita is watching us, I request her to be in the, because I have heard that she is much worried about blood pressure, and she should be here. Then Sandhya Gupta, she's from Delhi, one of my friend's sister. Is it, her question is very important. Is it diet-based? Which diet should I follow? Yes, this week we'll be discussing on lifestyle and hypertension. Whole week we'll be discussing on this. And let me tell you that hypertension has also a diet. उसमें भी एक diet हम ले सकते हैं, जो कि हम बोल सकते हैं उसको कि we have to take this low fat, mostly उसको बोलते हैं DASH diet, dietary approach to stop hypertension. And we'll discuss details in the next, I think tomorrow, you will be getting, tomorrow, day after tomorrow, you'll be getting all those things. And mostly you have to follow the veg diet. Your oil has to be less, vegetables has to be, the vegetables and fruits are to be more, and exercise has to be added into that. Right? And Jyoti Prakash Sahu from, I think, sector, he has wrote that how to be a member of the group for no medicine. You can, if you work on yourself, you automatically will be our member. And you have to learn and move forward with that. Sujata Pati, my sister, having problem for last 20 years. But I know ki problem everybody see, but solution nobody looks for. Solution is with us, but we always think ki it is not there. Blood pressure should be measured. It has to be taken care of. It should not be, we should not be lazy about our blood pressure measurement. I know her that I think master se thore blood pressure non hotive. Mujhe nahi. And also the irregularity not thivo. And then it is very difficult. 20 years, 25 years, 30 years, they are dying of blood pressure, which is a preventable and which is a reversible disease because of lack of knowledge. Not only, and I told you in the statistics, upon dekhi I quiz patedili, upon answer kete anni kete mark paidve. So kotha hochi ki only 15% of our country, in 15% people, their blood pressure is under control. 15% matra. सिर्फ 15% लोगों ने अपना ब्लड प्रेशर कंट्रोल में रखा है, बाकी लोगों ने नहीं. तो ये संख्या बहुत ही कम है और बहुत ही डरावना है. तो हमें इस 15 को 50 कैसे करें, 50 से 100 कैसे करें, ये पॉसिबल है अगर आप सब हमारे साथ दें और हम एक दूसरे के हाथ, एक सपोर्ट ग्रुप जो बना रहे हैं, इसमें हम लोग एक दूसरे को साथ दें. And I think this much questions were there. One more question was there, I think. Minati Mahapatra, Mrs. Minati Mahapatra, she's from Bhubaneswar. She is a very good patient and very good thing. She follows everything we talk about. And she, I think Minati Mahapatra, she is the cyclist. Arjun Awadi. I had gone to Bhubaneswar also, and वहाँ पे we had a program also. And madam, and you are doing everything we have learned. So keep it up, and you will be happy. And Mr. Dr. Sasidharan Gokul Iyer, he's from Pune, and he is a water sommelier of our you can say first water sommelier of the country. He had visited this place. He wants to understand how to neutralize hypertension without medications. How to neutralize medications, because they are working with water, alkaline water. They are thinking that is it possible that alkaline water will help us in neutralizing blood pressure or not. Now here is a point. Alkaline water is a good water, no doubt about it. It does, what do you say? It neutralizes our antioxidant, that's oxygen-free radicals. That is very good. It helps in preventing the further damage. But whatever damage has been done, because जिसके लिए blood pressure हुआ है, वो damage को करने के लिए you have to, water के साथ साथ you have to take your food, you have to go for exercise and everything. It is a holistic approach. Total approach can help you. Water will naturally, it will add on to this. So I'll tell Sasidharanji that water will help, but you have to adopt everything with that. Then only it will work. And Mr. Pranab Roy has told, again, saying having problem for 20 years. And I think I have finished people. And Vijay Bhanupati from Chained only, is my brother-in-law. So I was first diagnosed with hypertension in the year 2006. I am taking my medications and noticed now my BP is normal, 120/80, and heart rate is between 70 to 80. It is good because you are taking the medications. So this shows that you are very sincere towards, you are taking medications and you are sincere and you are following the things. Keep it up. So you don't have to stop medications. Medication has to go. But if you want to stop, then you have to consult your physician and then. Sarmista Karwa from Bhubaneswar. She wants to learn about these things too, because she is into some products. So she wants to educate people on health in society. Dr. Vibhuti Patnaik, curious about the challenge. He wanted to know what is the challenge. The challenge is that every day we'll send some information. So we'll engage people to take steps, small steps. These are all small steps, nothing big in that. But these small steps, at the end of the month, it becomes a big thing. I know. Everybody who is taking who is participating, जो participate कर रहे हैं, naturally उनकी ज़िंदगी में कुछ ना कुछ तो बदलाव आएगा, at least in the hypertension के मामले में. Because उनको उतना चीज़ पता चलेगा जो दूसरों को नहीं पता है. And I think we'll do it in other diseases also. Please be with us. Supriya Kaur is writing, she is doesn't have queries. And I think this much of people. Now this stage is open. आप लोग कुछ पूछना चाहें तो पूछ सकते हैं.
Does it affect systolic? Will it reduce systolic, or will it reduce diastolic, or will it reduce the gap?
Medication we will be discussing in the third week when with the expert. That I tell you, I'll just highlight it. But it is not systolic, diastolic. It is the mechanism is different. It acts in the cellular level. It improves your heart function and all these things. It acts in that level. So it is not one thing it does reduces. There are different.
It
will work on everything. Why not?
It will reduce your systolic. It will also reduce your diastolic. It will also maintain your. There
are a lot of medicines. When you come to medicine, there's a plethora, there's a box. Fine. They give the medicine according to the patient. Not that one medicine is given to एक medicine सबको नहीं मिलता है. उसकी हार्ट कंडीशन, उसका रीज़न क्या हो सकता है, कारण ढूंढ के उनको उसी हिसाब से मेडिसिन दिया जाता है. किसी को कैल्शियम चैनल ब्लॉकर मिलता है, तो किसी को वासोडाइलेटर मिलता है, तो किसी को यूरिनरी उसके लिए फ्लूइड लेवल को कम करने के लिए मिलता है. सो मेडिकेशन इज अ डिफरेंट पार्ट. So it is something to be discussed. One, we'll take a small one day only. Will one small video will send it. One.
Final answer is
Yes,
medicine reduces everything.
everything. It will improve your cardiac function. It will improve your arterial condition. Temporary. It's all temporary. Today you take a medicine, it will work for 7 or 8 hours, and it will be like this. Or if the half life is 1 day, once a day, it will work for 1 day only. It is only helping your heart to do the things better way. बट नॉट वर्किंग ऑन द कॉज ऑफ द थिंग्स. हमें कॉज रे काम करूँ हम लोग, उसका जो रीज़न जो रूट कॉज है वहाँ मेडिसिन काम नहीं कर रहा है. मेडिसिन इज हेल्पिंग यू टू इम्प्रूव द हार्ट कंडीशन, द वेसल कंडीशन, ऑल दिस थिंग्स. फाइन. सो रूट कॉज के लिए, बिकॉज यू आर द पीपल हु पर्सन हु आर गोइंग टू वर्क ऑन द रूट कॉज, नॉट द मेडिसिन. मेडिसिन विल कंट्रोल इट. आप इट विल वर्क इन ऑल द थ्री.
Now, one real life case I'm telling you, wife's case actually. BP 150 by 90, let us say 95, and pulse rate is 54.
ठीक है जी.
Once he starts doing some exercise, pulse rate increases, BP also falls.
Happen na. When you work more, because and have you heart check करा है जी? Any cardiac checkup has been done?
Completely Apollo hospital.
हाँ, तो हाँ, it was not maybe possible. It is nothing.
How it happens?
No, set up. Let this question keep it to the medicine specialist. Let them answer this. I am not going to ask on this particular thing, because these are your doctor will ask you. We are here to prevent the things how you will improve your heart now condition. Here, whatever you are talking is that you are improving your condition by following the certain things. And one day you will find this same medicine which you are taking, maybe there is some changes will come.
She doesn't take medicine. She doesn't take medicine.
Doctor has advised.
Once he advised,
Uh,
doctor, after she took the medicine, BP came down drastically.
hmm.
So doctor told her,
So you are not a hypertensive. नहीं oh what is last 6 days रे आपण BP जो सकाळ संध्याकाळी नेचुंदी, you give me, so me tell me what are the difference in the whole day. हाँ, it will vary, no problem. आपण को ऊपर डिपेंड करूची. See, it is a positional blood pressure. आपण सोइले अलगा हबो, बसिले अलगा हबो, चलले अलगा हबो, दौड़ले अलगा हबो, everything. No, there is no range. It all depends on you, how your heart is functioning. You can go. With, if you suppose you are doing a jogging, your BP can go 170, 180. Normal, that is normal. Nothing, not harmful. Your BP will change. हाँ, temporary high will happen according to your exertion. आपण हार्ट को केते परिमाणे काम करूचंती ता ऊपर डिपेंड करूची. आपणकर आपण एक्सरसाइज केले ब्लड प्रेशर विल इंक्रीज. फाइन, दैट इज नॉर्मल. बोथ विल इंक्रीज proportionately. डिपेंड करूची आपण कोन आपण हार्ट केमती फंक्शन करूची से समय. So if you are not a hypertensive, you are not supposed to worry. आपको worry नहीं होना है. If you are not on medication or you are not a hypertensive, you don't have to. You just have to measure your things, because it will vary. बुझले कि नहीं? And it will vary according to your work. It is not a constant. Up to a certain age, like in 30s, 40s, maybe. But आजकल तो in a young person also you are seeing blood pressure is very high. Once you are hypertensive, then you have to take medicine. If you are not a hypertensive, your blood pressure is within that 130, 140, and it is below 90. Mainly diastolic is below 90. Then nothing to worry about. That I told you, no. The real time is from morning re thore, evening re thore. Apno kari paribe. You should not be taking this. Morning, evening, di thore kale chalibo. The two things. Or if you are worried about now, if you want to keep a chart, apno chart pote dili, workbook pote dili, है ना? You go on filling that chart for every day for 7 days. Suppose you want to do 4 hourly, take 4 hourly, because you want to make yourself you want to know about your blood pressure. So you make a chart of it. At the end of 7 days, you will find out. So you make it next week. We'll show it to me. We'll see what is the difference. So you do it, because you have a blood pressure medicine instrument, and you have a chart. I've given you a chart. So according to the chart, fill the things, and next week basi kotha. So if you are not happening, why you are worried? So this worriness is a stress, and this also causes your blood pressure to rise. Fine. तो ज़्यादा स्ट्रेस लेके करना क्या है? अगर आप खुश रहो ना, माई ब्लड प्रेशर इज 130/90 और 80, उतना में खुश रहो, आपको क्या होगा बोल के सोच के क्या करना है? आप लोग टेक द ब्लड प्रेशर, मेक ए चार्ट फॉर 7 days, 10 days, 15 days फॉर योर हैप्पीनेस, डू इट, इट डजंट कॉस्ट यू एनीथिंग.
I have made a chart, doctor. I have taken medication. My systolic was 1 month back, it was always above 150, but 50 to 160. But diastolic was always below 70, always.
So you have to find out the cause.
I showed the doctor, added one more medicine. And now my
नहीं, मेडिसिन तो ऐड कर ले, बट व्हाट इज देयर हैज टू बी ए कॉज फॉर इट. दैट आई टोल्ड यू फ्यू कॉजेस. हाई पल्स प्रेशर,
now my systolic is from to 130 and diastolic always 70.
so you have must be having somewhere there must be hardening of the vessels then going on. So you have to change your lifestyle now. Medicine will help you for time, है ना.
Minimum 6 kilometers I am walking.
Walking is ठीक है, walking is good, but are you doing in a proper way? Are you adding something else? Because walking is a very first line of exercise. It is just a activity. You are doing a activity, but are you doing something for your heart, exercise for your heart? You are not doing it. So there are a lot of factors. Not only one factor. एक factor काम नहीं करता, लेकिन we have to see that. Now I want to improve myself. Now at the end of this month, you will know a lot of things what you have to do. No, that is okay. Diastolic below 70 is good. It's good. Systolic is with the age, your arterial wall is getting thicker. So now you have to change your food habits, change your very big. That's the reason. No, I told you there are few gap. Fine. 40 to 60. 40 to 60 it is pulse pressure is, I think you are doing well. 40 to 60 is normal. Below
Pulse rate is different. Pulse rate is not that gap. That gap is the pulse rate.
pulse pressure, not pulse rate. Pulse pressure, that is called pulse pressure. Pulse rate is different. Pulse rate is what you are.
72 I think
This is pulse rate. Pulse pressure is different. Pulse pressure is difference between systolic and diastolic.
systolic, diastolic and pulse.
That is pulse pressure difference.
There is a difference.
कोड़ा नहीं नहीं मशीन देखा है. That is pulse rate देखा है.
What is the indication of the pulse rate?
Pulse rate is your heart beat. ये तो कुछ चीज़ है. Pulse rate means your heart is beating at the rate of 72, 80. Depending on the requirement, देखो तो आपको कभी you have a healthy heart, your pulse rate will go down. Healthy heart means it is pumping very nicely. So 50 suppose athletes, their pulse rate is 50, 48, 50. Why? Because their heart is so strong, with 50 beats, it is supplying the whole blood. बुझे कि नहीं? But a person having a heart condition, their heart is weak. So it has to push more. So heart rate will go high. So that is bad. बुझे कि नहीं? Heart rate will be bad if your heart, that is heart rate और pulse rate जहाँ कौन से अपना, वो अगर ज़्यादा है, मतलब आपका हार्ट ज़्यादा काम कर रहा है उतना ब्लड सप्लाई करने के लिए. But if your heart is healthy, it will be doing it less. So the people who does exercises, whose heart is good, whose heart muscles are good, then it will pump in 60 also, it will pump the same amount of blood.
Hypertension has a heart failure chance from.
किन दिया?
Pulse rate of 52.
कहाँ रहो? नहीं 52 pulse rate अच्छी ना? बढ़िया healthy heart. हाँ.
So hypertension is very
But nobody has told कि she is hypertensive. She is telling she is hypertensive. हाँ. But nobody has told you hypertensive. हाँ. So if you this is what is this challenge is for. Once you understand what is hypertension, what is your heart, so then because we are highlighting the things. Their heart, which I take around 5 to 6 classes only for heart. because there you understand everything in the heart. That will be coming next month to आरंभ करें, है ना? Because one batch is getting ready, so anybody who wants to be enrolled, they can enroll. Fine, we'll do that. So understand your body and your mind. Thank you very much. I think. हाँ? किए? और तो ऑन कर दी? सिलेक्ट बंद कर दे ताले. Select बंद कर दे तू. So we will close that one with again and with the song on demand. Song केंदी है ची आपण केंदी लागला?
स्वयं सेवा सर्वोच्च सेवा स्वयं सेवा हो हमारी राह जीवन बने उज्जवल गाथा औरों को दें हम रोशनी स्वस्थ जीवन खुशहाल सजीवता स्वस्थता का रहस्य पहचाने स्वयं सेवा सर्वोच्च सेवा स्वयं सेवा हो हमारी राह जीवन बने उज्जवल गाथा औरों को दें हम रोशनी स्वस्थ जीवन की खुशहाल सजीवता पंथ का है संदेश हर इंसान बने स्वस्थ और विशेष अपने शरीर और मन को जाने स्वस्थता का रहस्य पहचाने प्रकृति शान अपनाए स्वास्थ्य का हर स्रोत जगाए परिश्रम हो साथी कभी जगत रचे हम सब मिलके साथी स्वयं को जानो और जग को बताओ स्वस्थ जीवन का अर्थ समझाओ सेवा और ज्ञानों और जग को बताओ स्वस्थ जीवन का अर्थ समझाओ सेवा और ज्ञानों एक सूत्र यही पथ है शुभ यही है श्रेष्ठ स्वयं को जानो जग को बताओ स्वस्थ जीवन का अर्थ समझाओ सेवा और ज्ञानों एक सूत्र यही पथ है शुभ यही है श्रेष्ठ स्वयं को जानो और जग को बताओ स्वस्थ जीवन का अर्थ समझाओ सेवा और ज्ञान हो एक सूत्र यही पथ है शुभ यही है श्रेष्ठ